Specimen Management and Microbiology.
Some general considerations when discussing specimen management would be to avoid contamination during collection. Sounds simple, right? But it can actually be difficult depending on the specimen, the type, and the location of where it's at. We need to make sure that we are transporting that specimen within 2 hours of collection to the lab. And if all possible, trying to collect during an acute phase of the illness. That'll be our greatest chance of, making sure that organism will grow for us. And it's also very important to collect prior to administration of any antibiotics, if at all possible. Kind of speaks for itself. If you're trying to test for an organism, you want to try to get the testing or the sample before they get something in their body trying to kill it. And then also aspirates are usually better than swabs for cultures, less risk of contamination, things like that. And it kind of shows it in the picture on the slide. Some initial considerations for lab specimens is making sure you have appropriate assessment for the labeling. We've already kind of discussed this as part of the quality assurance, but just making sure that the appropriate information is on the requisition. So anything that may be of assistance to us when performing the test is there. Also, in your textbook, make sure you review the specimen rejection criteria listed in there. Oftentimes, we will perform a gross examination of the specimen to look for any areas of blood or mucus. What comes to mind generally is like a stool culture, something like that. And those are the areas that you will select with the swab to plate. In some cases, you'll perform a direct microscopic exam if appropriate for that specimen site. So, for example, you don't always have a direct smear gram stain. That's actually used to determine specimen acceptability before the specimens are ever plated. Additional considerations are you don't do those direct exams on throats, nasopharyngeal, or stool specimens. And the reason is because there's just too much normal flora in those areas. You're not going to be able to know on a gram stain what's normal versus what's pathogenic at that point. Your most common stain in microbiology is the gram stain, and then the most common fungal stain is going to be your KOH prep, which we'll talk about later. Make sure that you know appropriate media for each site, as well as knowing appropriate incubation, temp, and atmospheric requirements for each. Critical values in microbiology. So we do have some critical values in microbiology. It's not micro is going to take some time as far as growing the culture and things like that. So you may not technically think of them as critical like you would in hematology or micro. But with that said, we do need to make sure that we are communicating to the clinician immediately if we do come across these critical values. And then making sure also, as your protocol would mention, to always make sure that you document who you talk to, date, and time. So some examples of critical values in microbiology, any blood cultures that are positive. So if you have a positive cerebral spinal fluid gram stain or a culture of group A strep and a surgical site gram stain that's suggestive of gangrene or a positive smear for malaria. Sometimes malaria is actually done in hematology, but since it's a parasite, we do talk about it here in microbiology again. A positive streptococcal antigen test, a positive acid-fast bacillus, or detection of any other significant pathogen. So you have to make sure that you pay attention to your SOP and your facility guidelines wherever you end up doing your clinicals or working, because they may have a more extensive list than what is listed here.